Here are just a few more features of the point that I may have overlooked in the intro video. One is here we're open to your Karch pharmacology course in the point. Under this tab, customer success, go down to student training. You're going to say you're a nursing student. So our pharmacology course is called a Course Point Plus because it's got extra features in it. So I'd like you to open this tab and there'll be a few videos that show you how to better navigate. Also, this is a few videos on PrepU adaptive quizzing, how exactly the adaptive quizzing works. As I said before, I'm not sure if you remember that the weekly quizzes that I'll be posting are instructor made or instructor generated, so they do not feed into your mastery of concepts or particular medications, but you can do those on your own. You can go to chapter 2 and say, I want to take a PrepU quiz, and it'll start to develop your own mastery level, and that's unique for each student. This is, if you click on this, this will help you with the fine points of your ebook, how to use the highlighters. There's about 10 different colors of highlighters, how to share, how to save and how to share your highlighted notes, how to use that text to voice. If you want to do text to audio, you want your iPad to read it to you, for instance, while you're knitting, or I don't know. I don't know. But there's a lot of features of the ebooks that will be revealed to you if you go into this tab right here. And I think, and the last thing is vSIMs for nursing. So there's also a tutorial under the vSIMs tab. You can do that as well. But this will also be additional information for you about how to use vSIMs. And realize that all this that I'm asking you to do, yes, it's in week 1. Yes, it's on top of actual content that's coming your way. But you only have to do this once until you familiarize yourself. I do want to show you in the book. Let's see if I've got a book open here. Here we go. This is your farm book. So if I haven't mentioned the term smart reading, I don't expect you, for instance, in week 1, there's 6, 7, 8, 9. There's like 9 chapters or 10 chapters. The bulk of that is the pharmacological basics, what you need to know, what are the concepts that apply across the board to all medications. And then we get into actual system medications. And we start with the GI medications, which means you're going to drop all the way down in your book to unit 11 to get to gastrointestinal medications. But so we're in that chapter. I just want to show you some examples of how you can smart read through the chapter. One is, here's the drug list. So this is chapter 57, drugs affecting GI secretions. And here we go down to the drug list. These are all the drugs that this chapter is going to talk about. I am going to refer to, in the focus video in a minute, I'm going to refer to certain drugs in these categories that I want you to focus on. But here's a great place for you to realize what's going on here with the drug naming if you're not familiar with nomenclature and how that can actually help you to remember some of your drugs. These are the histamine antagonists. So look at what they're all ending in tidine, tidine, cimetidine, famotidine. Actually, these are the top 2. Famotidine is the one that we use the most. Antacids all seem to have salt. Almost all have salt. The proton pump inhibitors, those are the prazols. So omeprazole, pantoprazole, those are the 2 main ones that we're familiar with pantoprazole being the most popular that we give in the hospital. And then, well, that's about all it is with naming. But you'll see that when it comes to beta blockers, when it comes to ACE inhibitors, there's a nomenclature for naming. And when you see the drugs listed on a list like this, you start to realize this is going to be a helpful memory tool for me as I go forward. So wherever you see a box, so smart reading involves paying attention to what the publisher has brought to the top of the page for you as far as importance. And they do that by trying to get your attention visually. So here's some more boxes. Considerations that, conditions that affect GI secretions, and this actually has some disorders in it. Evidence-based practice is huge. That's what we base our nursing practice on. So whenever you see a green evidence box, take a minute to look at that, because that's going to have timely information for you. And graphics. This is a great graphic that shows you which drugs work where in the GI tract, which work in the stomach, which work in the liver, which work in the intestine. So that's an important concept for you. Drug therapy across the lifespan. That is an important concept as we hit the basics before we get started. Know that you can disregard children. You can read it if you like because it's interesting, but I'm not going to hold you to any information. When I say across the lifespan, I'm talking about an adult into geriatric population. And there are huge considerations for our medication when it comes to older adults. And we'll talk about that as we go along. So here's another table that gives you drugs and their usual dosages and usual indications. I'm not going to really hold you to dosages, but I am probably going to hold you to generalizations when it comes to indications. You need to know that this is a drug that is, first of all, it's a GI drug, if we're talking about that drug, and where it works and why we give it. So somewhere here, here's a critical thinking scenario. That's going to be interesting for you. Critical thinking scenarios take real life clinical situations and apply theory, and that does help you remember things. So pay attention to those when you see those come across your page. Nursing considerations, huge. Paramedics, whenever you see a blue box that's entitled nursing considerations for blah, 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 here we have for H2 antagonists, here's where you have the nursing process start to be laid out for you. The assessment, the nursing diagnosis, the planning, the implementation, and the evaluation. Here is the nursing process as it applies to nursing responsibilities when giving these kinds of medications to patients. So please pay attention to the blue box nursing considerations as you come across that in your reading. The next is key points. Key points is a great box. It's not very colorful here. It's in gray, but key points of the chapter as we're going through it. You see that we're not to the end yet, but do pay attention to key points. And then there's something called focus on, here's more nursing considerations, key points. Here we go. It's in red. It really gets your attention. Focus on safe medication administration. Always read these red boxes. So you have to imagine me as an instructor who's going to be giving you 4 exams throughout the semester. For instance, our first exam is on 3 weeks of content and many chapters, possibly 30 chapters in the book. What kinds of questions do you think I'm going to be giving you? I'm going to be giving you questions on the most important points. And these are ways that the author has tried to pull out important points and concepts for you. This is what I call smart reading. So I may not be reading every single word here, but for sure I'm going to be reading these important boxes and notifications that pop up. I told you about the diagrams. Then at the end of every chapter, here's some more great diagrams. Nursing considerations for patients receiving proton pump inhibitors. Yes, you're going to read that, and I'll tell you more about that in a minute when we get to our GI drugs. Key points, and then we'll go to the end of the chapter. Summary. This is a summary of the entire chapter. Read this, and then go through. There's 10 questions at the end of almost every chapter called Check Your Understanding. Again, these are multiple choice questions based on some of the important points that have been laid out in this chapter. So when you see that you have to cover 6 or, well, actually, I think week 1 is the worst when it comes to the amount of chapters we're covering here. But this is the way I want you to read them. This is realistic. This is real life, how you're going to attack this knowledge. But you need to check yourself. So whether or not you choose to go start determining your proficiency or your mastery of this in Prep U, say you're going to go and quiz yourself in Prep U on this chapter, whether or not you do that, do this. Take the questions at the end of the chapter and see how you do. And if you don't do very well, it means that you need to go back and review some more of the chapter. Thanks.